Hi, it's Patrick from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog I shared long-term ventilation, tracheostomy and intensive care. It's time for a new paradigm. You can check out the last blog by clicking on the link below this video. In this week's blog I want to share with you long-term ventilation and tracheostomy in intensive care. Does patient care need to be reinvented? Long-term ventilation and tracheostomy in intensive care is the second highest ranking DRG or diagnosis related group when it comes to costs and expenses in Australia. Only LVAD or left ventricular arrest device insertion is more expensive in intensive care. Those statistics and numbers have been published by the Independent Hospital Pricing Authority in Australia. Hundreds of thousands and millions of dollars of taxpayers' money are being wasted, often at the detriment of hospitals, intensive care units and, worst of all, the quality of life and or the quality of end of life for long-term ventilated adults and children with tracheostomies and their families. On top of the massive expenses, and we're talking about up to $5,000 per bed day in intensive care for long-term ventilated adults and children with tracheostomies, there are the issues of bed blocks when long-term ventilated adults and children with tracheostomies occupy beds long-term in ICU. Most intensive care units, long-term ventilated adults and children with tracheostomies, as well as healthcare funding agencies in other first world countries around the world, are having similar issues. After all, intensive care units in first world countries tend to be similar, and I think I'm somewhat qualified to say that, given that I worked in intensive care in 3 different countries. So other first world countries, mainly Germany, Austria and Switzerland, have realized more than 20 years ago that the massive expenses, as well as the poor quality of life for long-term ventilated adults and children with tracheostomies in intensive care are a massive dilemma and are non-sustainable. They came up with a model that is sustainable, efficient, patient and family friendly, provides intensive care units with more resources and is massively reducing the costs for departments of health and private health insurances. Patient care for long-term ventilated adults and children with tracheostomies was literally reinvented, and it's a win-win situation. Furthermore, in the Australian healthcare context, while waiting lists are an issue, by freeing up intensive care beds and sending long-term ventilated adults and children with tracheostomies home with specialized services like intensive care at home, waiting lists can be reduced. Here in Australia, a home care model for long-term ventilated intensive care patients is a very much needed model, as the growing and uncontrollable cost for long-term ventilated adults and children with tracheostomies in intensive care is spiraling out of control. Intensive care at home is providing such a model of care, and we are very successful in providing intensive home care to our clients and their families. We are a fully accredited service provider, and we show on a day-by-day basis that our model of care works. Long-term ventilation and tracheostomy, we are certainly reinventing patient and family care. For more information you can contact me on 041 094 2230, or you can send me an email to patrick@intensivecareathome.com.au, or simply leave a comment on the blog or on our contacts tab. We also currently have opportunities for experienced intensive care nurses with a critical care certificate for ventilated clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities here as well. For more information, check out our career section or contact me. You can also contact me if you want to know more about how we can help you and your intensive care unit, or your patients and families, or if your loved one is in intensive care on a ventilator, please contact us. Thank you for tuning into this week's blog. This is Patrick Hutzer from Intensive Care at Home, and I'll see you again next week in another update.